Asthma, the breathing burden. Asthma is defined as an obstructive disease, and it's one of the most commonly seen respiratory diseases in clinical medicine. Anatomic alterations of the lung include bronchial spasm, airway inflammation, and excessive production of thick, whitish bronchial secretions. Patients suffering from an asthma attack will present with hyperventilation, increased work of breathing, pursed-lipped breathing, increased heart rate and blood pressure, and barrel chest. Tests and procedures. PFT, an increase of FEV1 greater than 12% after a bronchodilator is administered suggests reversible airflow limitation. If FEV1 FVC ratio is less than 75% predicted, it also indicates airflow limitation. PEFR improvement of 20% after bronchodilator suggests asthma. ABGs will present with acute respiratory alkalosis with mild to moderate asthma attacks, while severe asthma attacks will present with acute respiratory acidosis. Sputum examination will show an increased number of eosinophils, presence of Charcot-Leyden crystals, cast of mucus from small airways, and an elevated IgE level. Finally, the chest X-ray will show the presence of a barrel chest, translucent lung fields, and a flattened or depressed diaphragm. Diagnosis. In early childhood, the diagnosis is based off of symptoms and physical findings. In older children and adults, it is based off a complete history and physical examination, also a demonstration of reversible and variable airflow obstruction. As symptoms and clinical manifestations are similar, asthma is often misdiagnosed as COPD or chronic bronchitis. These clinical diagnosis guidelines are created by GINA, also known as the Global Initiative for Asthma. Prognosis. Most patients suffering from an asthma exacerbation are easily reversed and treated. In more severe cases, such as status asthmaticus, the patient is most likely in acute ventilatory failure and needs to be intubated stat. Asthma is an easily maintainable disease if the patient follows their specific medications and treatment. Asthma treatments, ICU treatment. For patients suffering from status asthmaticus, they will most likely be on mechanical ventilation and in the ICU to be monitored. They will be given inhaled B2 agonists, anticholinergics, and glucocorticosteroids. For floor care treatment, oxygen, inhaled B2 agonists, glucocorticosteroids are also given, but patients are also reassessed to see if medications are continued, altered, or discontinued. Planning and prevention, asthma action plan. The asthma action plan is pretty much just a plan that lets asthmatics know where they're standing with their disease. Green being good, yellow, okay, red, bad. This plan is used by asthmatics to keep their asthma in check so they can go on living a normal life. So that is it for the PowerPoint, and here's the video. No asthmatics were harmed in the making of it.
Let's get down to business to defeat the Huns. Did they send me daughters when I asked for sons? You're the saddest bunch I ever met, but you can bet before we're through, Mister, I'll make a man out of you. Tranquil as a forest, but on fire within. Once you find your center, you are sure to win. You're a spineless, pale, pathetic lot, and you haven't got a clue. Somehow I'll make a man out of you.
Mom, can you take me to the hospital? I can't breathe. Are you alright? I'm alright. Not quite alright. Now my money's right. Kind of been the way to the top to heavy falling on. Kind of been the way to the top to it's falling on. I don't really care if you cry. I don't really shouldn't have a lie.
Hi, Miss Goodare.
Hi.
Hi, I'm your physician, Dr. Hill. How are you today?
I'm okay.
Doing a little bit better?
Yeah, I feel better than before.
Alright. I'm struggling with these gloves.
I
Okay.
still feel like I'm breathing pretty quickly, not as normal as.
Yeah, you're fine. Let's make sure this is you. Okay. So you said you feel like you're breathing better, but not like back to normal?
Yeah, just a little bit still quicker than normal.
Okay. Well, it seems like your vitals are a lot better from when you first came in. We're gonna go ahead and go with the third round of albuterol and ibuprofen.
Okay.
Go ahead and breathe in. Yeah, because I still hear a little bit of wheezing. Go ahead and breathe in. Take your time. Have you sit up for me? Okay. Yeah, so we still hear some wheezing, so I'm gonna go ahead and send your RTN. You've already done the 2 treatments, so it's the same process, everything.
Okay.
So after we're done with that, I'll come back in and see how everything's going, okay? See if we can get you discharged today or not.
Okay.
Alrighty. Any questions for me so far?
Nope.
Alright, well you have a good one. I'll send the RTN, okay?
Thank you.
Mm-hmm. Hi, Becky. Yeah, I'm Elena from Respiratory. How are you feeling?
I'm okay. I still feel like I'm breathing pretty quickly though.
Oh yeah, I was checking your chart. This is your third round. So can I check your husband?
Yeah.
Okay, and what's your date of birth?
125.91.
Right. Okay. So yeah, I'm about to give you your third treatment. So what got you in here?
I was exercising and I overdid it and I had asthma attack.
Oh wow.
But my inhaler wasn't working, and about an hour after that, I had another asthma attack when I was just sitting down doing nothing.
Ooh, yeah,
So-
that's not good. Okay, well hopefully after today we can get your asthma under control, you know? So you know how to take these?
Yeah, I did 2 rounds earlier.
Okay, so just give me a quick run through.
So I just form a seal around the mouthpiece and I just breathe in the medication, and I just every once in a while I'll breathe in a deep breath and hold it in, and then just continue breathing normally.
Right, just want to make sure you know you got it.
Okay.
Okay. So I'm gonna check your breathing real quick. Yeah, hopefully this treatment really opens you up a little bit more. Okay, how's that going? I'm sputtering a little bit. Let me see. Yeah, you're about done. So let me check your breathing one more time before I go. Hopefully this opens you up. How are you feeling?
I feel a lot better. I don't feel like I'm breathing as fast. I feel a little shaky, but I think that's from the medication.
Yeah, that's the albuterol. Oh yeah, you sound a lot better. Excuse me. Yeah. Yeah, you sound a lot better. It really opened you up. And you'll probably feel a little shaky and your heart rate's gonna be a little fast. That's just the albuterol. Alright, so I'm gonna see about you getting discharged today.
Okay.
So I'm gonna go find your doctor.
Alright.
Hope you feel better.
Thank you.
Hey, Becky, I'm back. How are you feeling?
I feel a lot better.
That's good. So our doctor wants to send you home today.
Yeah.
Oh, what are we gonna do without you here?
I can do it.
Maybe we'll see. The good thing is make sure you live. So the doctor wanted to send you home with the care package,
Okay.
the asthma care plan. Make sure you have your asthma managed and everything. So he sent you home with an inhaler.
Okay.
Now you have one of these, right?
Yeah.
Have you ever used it with the spacer?
No.
Okay. So these are great. The cool thing about these is they make sure you get all of the medication.
Oh, okay.
A lot of times if you use your inhaler, it just kind of in your mouth. It doesn't go to where it needs to go. But with the spacer, you have the time to inhale all of that in. So basically you just fit it in here and, one little puff. And you're going to exhale as usual. And you're going to just breathe in really deeply. But make sure you do it slowly. If you hear like a whistling sound, then you did it too fast.
Okay.
Just kind of breathe in slowly. So we're going to send you home with this. And then we're going to send you home with this peak flow meter. Are you familiar with this? Okay. So these, they measure exactly, how your asthma is doing and everything. Comes with a little brochure. Based off of your age and your height,
Okay.
it tells you what your best should be.
Okay.
Now, the way you use these is, I'm going to send this home with you. The good thing for you to do is to stand up, straight and tall. Exhale. Make sure this is all the way to 0. And then take a deep breath. And then blow out as hard as you can.
Okay.
And you're going to do this 3 times. And you're going to write each of them down, record it. And the best one is your personal best. Now, if you reach about 80% and above of what your personal best is, then you're doing good.
Okay.
You're doing everything right, you're just fine. But if you reached about 79 to about 50, then you're not doing that well.
Okay.
You need to get to your doctor, tweak your medication, something. If it's anything below 50, you need to get right back here, like immediately, because then your asthma is just out of control. Okay. So, yeah, that's about it. So I'm also going to send you home, the doctor sent you home with the corticosteroid. See, the thing with those is They help with your inflammation that causes you to have a hard time breathing with your asthma.
Okay.
And the goal is if you take that maintenance inhaler, you won't need your rescue inhaler as much.
Okay.
Because we want you to be able to live your life, exercise, do everything without worrying about my asthma, you know?
Yeah.
This, you know, it's the same thing. The way you use the rescue inhaler, the same way. The only difference is you should make sure you rinse your mouth out afterwards.
Okay.
So, yeah, you're done here. I'll make sure all this is in your patient bag and you have all your prescriptions. And you should be out of here in about at least an hour, but I'm going to try to get you out soon.
All right.
All right, well, I hope you feel better.
Thank you.
Thank you. Bye.
Okay, it's rolling, so whenever you're ready. All right, it's going. Whenever you're ready. All right, it's rolling.
So what do? I just start like.
Dying.
Jumped in.
That was a good one. What happened?
His face. He's like. You can't tell.
A lot of crazy stuff.
I hope they have restraints on you.
You got hit by a bus.
Change your face.